Welcome to our channel. Today, we will discuss the correlation between post-traumatic stress disorder or PTSD and erectile dysfunction, and how veterans can seek disability benefits from the Department of Veterans Affairs. Let's get started. PTSD can have a significant impact on various areas of your life, including your ability to achieve and maintain an erection. If your erectile dysfunction is causing difficulties in your everyday activities and is linked to your PTSD resulting from military service, you may be eligible for Special Monthly Compensation or SMC from the VA. Let's explain briefly what is post-traumatic stress disorder, or PTSD. PTSD is a mental health condition that develops after a person experiences or witnesses a traumatic event. It is commonly associated with combat veterans who have served in war zones, although other events during service can also be the cause. Symptoms of PTSD can include flashbacks, nightmares, hypervigilance, and emotional distress. Now, what is erectile dysfunction? Erectile dysfunction, often referred to as ED, is the inability to achieve or maintain an erection sufficient for sexual activity. While ED can have various causes, studies have shown a significant correlation between PTSD and the development of ED in veterans. Let's talk about the link between PTSD and ED. Research suggests that the physiological and psychological effects of PTSD and contribute to the development of ED. The constant state of hypervigilance, anxiety, and depression associated with PTSD can disrupt normal sexual functioning. Furthermore, the effects of trauma on the brain can interfere with the release of neurotransmitters necessary for the erectile response. Also, some medications used to treat the symptoms of PTSD can cause ED as a side effect. When applying for VA disability benefits, it is essential to provide strong medical evidence to support your claim. This can include: Number 1, medical records documenting your PTSD diagnosis and treatment history. Number 2, statements from healthcare professionals who have treated you for PTSD and ED. Number 3, records of any prescribed medications or therapies for ED. And number 4, any relevant test results, such as hormone levels or psychological evaluations. When it's time to fill out your claim, make sure to complete the form accurately to avoid any delays. Provide all necessary medical evidence, and if you are confused, look for assistance from a VSO or from a VA-accredited attorney to guide you throughout the process. After you submit your claim, the VA will evaluate if an examination is needed, and for that the examiner will fill out the DBQ specific for that organ system. Please prepare by reading the DBQ carefully, so you know in advance what you'll be asked and have the answer for each question. When evaluating disability claims related to erectile dysfunction, the VA using the rating code 7522. Although it assigns a VA rating of 0%, it is compensable since it is considered a special monthly compensation. Remember, the VA rating process can be complex. To ensure accurate evaluation and appropriate compensation, veterans are encouraged to seek professional assistance, either to guide through the process or to review your records to prepare a Nexus Letter connecting the PTSD and your ED. By providing comprehensive medical evidence and working with professionals, veterans can maximize their chances of receiving the appropriate compensation. Thank you for watching. See you in our next video.